Hi everyone, my name is Mabel. Trying to fit in myself here. My name is Mabel, and in this video I'll be demonstrating how to reconstitute powder into liquid and how to administer it through an IV or a PICC line. So I'm going to wash my hands and gather my supplies. But first, I will check the physician's order, which states that the provider has written an order to administer 375 milligrams ceftriaxone IV push over 6 minutes, and the medication is available in 500 milligram vial. So I'm checking this order so that if I go into my medication room, I know what I'm getting. So now I'm going to get my stuff. So I'll need a pair of gloves. I need 2 syringes of different sizes. 2 syringes of different sizes. I need 2 needles of different sizes as well. I need my vials. I'll be using this one as my diluent, and I'll be using this one as my powder. Then also I am going to be needing alcohol wipes. I'm going to use this as my alcohol wipes. I'm going to use this as my cap, making sure that I can cap my needle when I need it, just to keep everything sterile. Then I'm going to be using this as my sharps container. Now I have everything. I'm going to get started. So I'm going to get my diluent and pop open the top of the vial bottle. When I open it, I'll discard of the cover right there. I'll use it as my sharps and my trash. So I'm going to use alcohol wipes. I'm going to use my alcohol wipes and cleanse it and cleanse the top part of it for at least 15 seconds to make sure that it's clean. So I'm going to let it to air dry. I'll put that in my trash. While it's air drying, I'm going to, since I'll be demonstrating how to reconstitute the powder medication, the order on the vial says that I need 4.8 milliliters of diluent for the IV. So this is my diluent. I'm going to 4.8 is a volume that I can use with this syringe, and then I'll get my bigger needle. So I'll open it up. I'll just place it there. Open it up. I'll connect my filter needle to my syringe. Make sure it's tight. And here you go. I'm going to take it out. I'll put it there so I can cap it. Can put that in the trash. So I need to withdraw 4.8 milliliters of diluent, which means that I'm going to pour 4.8 milliliters of air. So I'm going to, this is my diluent. I'll pour the air first, 4.8 milliliters. That is 4.8 right there. And then this, I'm going to put the air. It's a pretty big needle. I'm going to insert the air, which is 4.8 milliliters, into the diluent, keeping the needle in place. Now I'm going to turn my bottle upside down. This is burst, so I don't want no liquid throwing, so I'll put the bottle upside down, and then I'm going to pull the tip of the needle just above the stopper right here. That is if I pull it upside down, but since my bottle is kind of leaking, I'm just going to mention it. So I'll pull 4.8 milliliters into my syringe. 4.8. Just pour some is coming out. So I'll withdraw 4.8 right there. And I have my 4.8 milliliters. After I have my 4.8 milliliters, I'm going to take it out. Now I don't need this anymore, so I'm just going to put it by the side. So I'm going to, that's the reason why, there you go. I cap it just to keep everything sterile. Since I've already slided my needle into the cap, I'm going to now be kneading my powder medication. I'm going to do the same thing like I did. I'm going to open the top cover of it, and then I'll use my alcohol wipes and clean for at least 15 seconds. And I'll put that in the trash while I'm waiting for it to air dry. Once it's air dry, oh, excuse me. Now I am going to get my syringe. I am going to put my diluent into the powder. That is pretty big needle. So I'm going to push my diluent. As I insert my filter needle, I push my diluent into the bottle, 4.8. And now why I'm doing that, I want to make sure that I avoid creating bubbles, because that will not be good for our solution. After I do that, now I'm about to take out my needle. I'll bring it above the surface, like right where it's empty, and then I'll pull out 4.8 milliliters of air. 4.8 right there. When I pull it, and then I'll take out my needle, and everything with this goes into the sharps container. And the reason why I pull out 4.8 milliliters of air after I've injected my diluent into the powder is to ensure that there is no pressure in the bottle. So now I am going to gently agitate my bottle, or just move it around like that, just to make sure my diluent and my powder are combined properly, leaving no bumps or anything. After I do that, I have my new needle and my new syringe, which I'm going to use. So since with my order I'm going to be withdrawing 3.8, I have a smaller syringe and a smaller needle. So I'm going to open my needle, and I'll connect my syringe to it. Make sure it's tight properly. I want to make sure the filter needle is tight properly. Now it's ready for me to use. I'm going to uncap it. So my order, which I'm going to administer, is 3.8 milliliters. I'm just going to withdraw it. So I'm going to stick my needle in here. As I put my needle in here, I'm going to withdraw 3.8 milliliters of the medication into my syringe. I want to make sure I'm seeing that 3.8 without creating any bubbles. Since I don't have enough liquid in here, it will not show me pulling the 3.8. Let me see if I can do this. 3.83. 3.8. Now if I have any bubbles in there, I'm just going to hit my syringe to make sure I have no bubbles. And there you go, I have my 3.8 milliliters of medication. Now I'm going to remove my needle and discard of it. I don't want to pierce my hand, so I'm going to cap it like that, and I'll take it out straight into my sharps container, and then I'll cap this to make sure it's sterile. I'm just going to cap it like that and lay it down. Now my order to administer, it's an IV. If it were to be an intramuscular, and then I'll look for another needle that is appropriate for the medication for me to administer to the patient. But my order is to administer through an IV into an inserted catheter. So that is why I'm taking out the needle and just capping it to get ready to go administer at the bedside. So my client, initially, I don't know if I mentioned, the client already has an inserted catheter, an IV line, a PICC line into the hand that I'll be using. So now I'm going to clear my table of all the trash and everything. If at all we'll use this again. Now I'm ready to go to the bedside of the patient to administer in a proper way. I'll wash my hands after all of this, and then I'll get my pair of gloves. I'll be using this as my hand. That is the IV pot. And then I'll be using this as my saline, just to flush the IV to make sure it's patent. And then my alcohol wipes. I already washed my hands. Now I'm going to the patient's room. I get into the patient's room. I will knock. I introduce myself, and I'll let the client know that I'm here because I have an order to administer 3.8 milliliters of cetrizone through the client's IV catheter. And then I'll ask the client to state their name and date of birth. And if that matches my record, I'm going to wash my hands now that I'm in the client's room. And then I'll put on my gloves. My gloves is on. I am going to perform the 5 rites of medication just to make sure that I'm going to administer the right thing. I've already performed the first 2, or the first one, which was to identify the patient and his date of birth. So now I'm going to make sure that it is the right medication, it is the right route, it is the right dose, and it is the right time for me to administer the medication. I'm going to assess the IV site to make sure that there is no swelling, there is no infiltration, there is no redness or any draining before I can administer my medication. I have done that, it's fine. I'm going to flush the IV, so I'm going to be using my alcohol wipes. Then I'll open the IV pot right there, put the cap right there. I'll clean it. Just making sure everything is sterile. And I clean it, and then I'll get my saline. I'm going to be using this as my saline. And then I'll flush the IV line. Once I do that, that is my trash. Now after I flush the IV line to make sure that it's patent, and you can see the medication has gone through, which means that the line is patent and it's ready for me to administer my medication. I am going to uncap my syringe right here, and then I'll connect it there, and then I'll administer my medication. As I administer my medication, that is done. I want to pour fluid there. I'm going to put that into my sharps container right away. And then I need more saline. Shouldn't have discarded the other one. I need more saline to flush one more time. And then after I flush that last time, and then I'll cap my ivy pot. Make sure it's covered and clean. So after I do this, I'll clear my table of any trash, and then I will take off my gloves. I'll lower the bed to its lowest position. I'll make sure the client has their call light within reach, maybe any water if they need anything. Then I'll wash my hands. After I wash my hands, then I will document how the process was, and then that will be the end of my video. I hope you guys enjoyed it. Thank you for watching.